1 out of 10 adults worldwide have chronic kidney disease. It can be life-threatening if not treated early enough. This week, the world celebrates World Kidney Day with the theme, Kidney Health for All. This is our focus today on Sound Health. I am Olasumbo Modupe. You are watching Sound Health on Lagos Television. The program continues with COVID-19 update. Please stay tuned.
In the past few months, there has been unprecedented levels of disease transmission across the world due to the Omicron variant. Still, unequal access to COVID-19 vaccines, tests and treatments is rampant, prolonging the pandemic. According to the DG, World Health Organization, Dr. Tedros Ghebreyesus, 23 countries are yet to fully vaccinate 10% of their populations. 73 countries are yet to achieve 40% coverage, and many more are projected to miss the 70% target by the middle of this year. He explained that the biggest challenges are in low-income countries, which are concentrated in Africa. Only 7% of people in low-income countries have been fully vaccinated, compared with 73% in high-income countries. However, safeguarding the health of people living in the world's poorest countries in the face of a changing pandemic is a key priority. Dr. Ghebreyesus called on key players to ensure that these countries have the access, the means, and the capacity to vaccinate their populations, especially those who are most at risk. Despite the challenges, there has been progress. The vaccine supply constraints from last year have eased, and export restrictions are not currently an issue. Efforts must now focus on supporting countries to increase vaccination rates. A top priority to end the pandemic is deploying financing quickly to accelerate the development, production, and equitable access to COVID-19 tests, treatments, and vaccines in low and middle-income countries. Fully funding the Access to COVID-19 Tools Accelerator is critical.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Ayoola Odeyemi, Consultant Physician and Nephrologist with Lagos University Teaching Hospital, Ikeja. Good evening, Dr. Odeyemi.
Good evening. Good evening, everyone.
All right, all of a sudden, chronic kidney disease have become a major condition in the country. What causes this condition?
So the common causes of chronic kidney disease, and I'm going to narrow it down to this environment. Topping the list is hypertension, which layman we call high blood pressure, and followed by diabetic mellitus. Sometimes we can have an inflammation of the kidney, resulting in a terminology called chronic glomerulonephritis. This is a very common cause of kidney disease among the young. Then other causes include infections like HIV, hepatitis B, hepatitis C. Sometimes recurrent urinary tract infections can lead to scarring of the kidneys, which will ultimately damage the kidney, causing chronic kidney disease. Sometimes causes of kidney disease can be hereditary. It can be genetic. There can be cyst formation in the kidneys called the autosomal polycystic kidney disease. We can have in sickle cell disease patients, they can come down with kidney disease as a result of the state. Other causes in middle-aged men, we have prostate enlargement. which can be benign, enlargement, or cancerous. We also have other causes like kidney stones. If kidney stones, especially if it involves both kidneys, and it's causing an obstruction to urine flow, it can ultimately lead to the damage of the kidneys. So essentially, kidney disease is defined as damage to the kidney lasting more than 3 months. Yeah, thank you.
All right, according to the World Health Organization, children now have this condition at an early stage. What are the symptoms we must look out for in order to detect this early?
So, because chronic kidney disease is a progressive illness, and it has essentially 5 stages from the mild to the advanced stage. It's in the early stages of chronic kidney disease, it can be asymptomatic. The patient does not have symptoms. The only thing the patient will have is risk factors for the disease. Like, for example, the patient is hypertensive, the patient is diabetic, the patient has obvious reasons, the obvious causes of chronic kidney disease. Then, if the stages continue unchecked, the individual can develop swollen limbs, swollen legs, swollen face. There can be foaming urine. Actually, every urine should foam, but when it becomes noticeable, it becomes excessive, then it becomes a problem, and it's a very common symptom of chronic kidney disease. Then there can be blood in the urine. There can be usually we're not expected to pee more than 1 or twice at night, but now the patient can now start urinating up to 4 or 5 times at night. This is a terminology called nocturia. So all these are early symptoms of chronic kidney disease. Usually, if this stage progresses without an intervention, it can lead to complete damage of the kidney, called the advanced kidney disease or the early stage kidney disease. And in this stage, the kidney is not able to perform its functions to meet the requirement of the body. So, what are the functions of the kidneys? The primary function of the kidneys is to excrete out waste products from the body, and also to maintain water balance in the body. And the kidney also produces a particular substance called erythropoietin. Without this substance, blood is not formed. The kidney also helps in giving bone strength and vitality. So, in patients that has a significant damage to the kidney, patient with advanced chronic kidney disease, the individual can now start presenting with symptoms like vomiting, like excessive coughs, like getting tired easily, not being able to eat, swollen legs, swollen tummy. The individual can even have body rash, can develop, it is multi-systemic in very advanced cases.
Okay, in your response earlier, you pointed out that there are risk factors that predisposes a person to the condition, to chronic kidney disease. It is worrisome to hear that children also have these conditions.
Yes.
Is it hereditary?
So, remember I said that when I was talking about the causes of chronic kidney disease, I made mention of the fact that it can be genetic and it can be hereditary. Sometimes there can be congenital anomaly of the kidney. Congenital anomaly means that when a baby is born with malformed organs, so it's very possible that the kidneys are malformed right from birth. A common example is the location of the kidney is usually at the flank, at the lower back. But sometimes the kidneys can be found in the pelvis, where the bladder or the uterus should be. It's called a pelvis kidney, and the shape might be abnormal. Common example is the offshoot kidney. So all these anomalies. So when it comes to lifestyle, the westernization of our culture good sides, at the same time has its own bad sides. Our diet, right now, we consume a lot of condiments in our food, excessive salt intake. We have a lot of condiments that is deleterious to the human health, and it affects ultimately the kidney function. So essentially, high salt intake, consumption of herbal products, in these days of beauty and beautification, we have a lot of herbal products littered everywhere on social media. These herbal products, they are not passing through any regulatory agency, so we are not really sure about the safety of these herbal products. So all these things, and incidentally, anything we consume, either through our skin, through the lungs, through the mouth, anything we consume into our body passes through the kidney. So if the broken down product is injurious to the kidneys, and so as coming out, it's damaging the kidney. So now imagine if the individual now repeatedly use such products. So herbal products is a common cause of, it's a common risk factor for kidney disease. Then if you are hypertensive, you're not taking your medication, or you're not even aware that you are hypertensive, so and your blood pressure is not controlled, it ultimately damage the kidney. Smoking, excessive alcohol intake, all these things are risk factors. Then lifestyle that predispose an individual to having infections, viral infections like HIV. And this is unprotected sexual intercourse, scarifications, so all these things, hepatitis B, C, all these behaviors increases the risk of developing viral infections, which can cause kidney disease, especially in blacks. So all these are the major, I think I won't forget about the bleaching creams. The bleaching creams is the major culprit when it comes to kidney disease, and I strongly advocate that it should be discouraged. Any medications, on also use of painkillers too, especially the non-steroidal anti-inflammatory drugs like ibuprofen, like diclofenac. Excessive use, prolonged, continual use of these medications, especially in individuals that are hypertensive, diabetic, increases the risk of such an individual progressing to having a kidney disease. So I think I've been able to talk about the common risk factors for kidney disease.
Okay, Dr. Odeyemi, is this condition treatable?
So
and what should be done when you observe that you're experiencing the symptoms you mentioned earlier?
So the beauty of this disease is that it is preventable, it is treatable and manageable. It's preventable in the sense that if it's detected early, we can actually prevent it from progressing to kidney disease. If it's detected in the early stages, all what we just need is to ensure a good blood pressure control, ensure good blood sugar control in diabetic patients, counsel the patient on lifestyle changes, advise the patient against unauthorized use of medication. So all these things can prevent it in individuals that even have supposed risk of developing kidney disease. Then for individuals that already have the disease, we can manage it. The goal of managing such individuals include retarding progression. You want to delay progression of the disease from moving from where it is to the end stage. So it's very possible. All precautions and medications routine should be used. So in individuals with advanced, so because it's not very possible in this environment, people don't come to the hospital unless the situation is critical or advanced. So most of the patients we see already have advanced kidney disease. So what are the options? How can we go about treating them? So the goal of managing such categories, such cohorts of patients is one, we can either replace the kidney, called the kidney transplantation, or we take over the function of the kidneys. All these things, all these two modalities of treatment they've been shown to effectively treat the condition. The patient can be on dialysis, can be a form of treatment, while kidney transplantation can be a form of treatment. But it's just quite unfortunate that these two modalities of treatment is quite expensive and beyond the reach of average Nigerian. So the advice, the goal of management, the goal is for proper screening, for early screening, and for early management of the patient, rather than allowing them to progress to end-stage kidney disease.
Okay, no doubt the cost of treatment and management is huge. Now, aside dialysis and replacement, are there other alternatives? I understand that the Lagos State University Teaching Hospital is also coming up with a laser treatment for kidney stones. Can you please give a brief overview on that?
So the Lagos State Teaching Hospital is actually a front runner when it comes to kidney care, and there are so many initiatives on ground. The hospital is rendering dialysis services, is rendering kidney transplant services. The government is passionate about kidney transplantation, and recently the hospital just acquired this laser therapy for patients with kidney stones. It's called the extracorporeal shockwave lithotripsy. And in the layman term, it means that somebody has a kidney stone. Kidney stones are abnormal. There shouldn't be stones in the kidney. And when these stones occur, they obstruct the flow of urine from the kidneys to the ureter, to the bladder, and out. So what the treatment is all about is non-invasive, and the whole purpose is to break the stones, is to crush the stones. I think that's a better word to use. Is to crush the stones into tiny fragments. So when the stones are crushed into tiny fragments, the normal urine flow will just flush it out and through the urine. So that is what it's all about. And that treatment alone has saved a lot of patients, has prevented a lot of patients from developing kidney damage. And it's quite affordable. It's very accessible, and it's done. It's available at the Lagos State Teaching Hospital.
All right, thank you so much for that explicit explanation. This year's theme for the World Kidney Day is kidney health for all. How do we ensure members of the public are better informed about their kidney, how to take care of their kidney now?
So the World Kidney Day thing that is coming up March 10th, the theme is kidney health for all, and it's all about bridging the knowledge gap to better kidney care. So information is key. I believe that the person that has the right information is empowered, and the major difference between life and death, information plays a very critical role. And I want to use this opportunity to advise the member of the public, that we should be more concerned about our lifestyle. We should ensure that we reduce our salt consumption. We should ensure that we reduce intake of artificial condiments. I will naturally I'm a natural advocate for natural condiments like ginger, like turmeric, like crayfish, onions, locust beans, not the one they mixed with salt. It's still going to make the food sweet anyway. They are much better and healthier than the artificial condiments. For people that smoke, please stop smoking. Abuse of medications, abuse of illicit drug use. We should ensure that we should take an average of 3 liters of water on a daily basis. Because most people don't drink water, and water is life. The more water we drink, the healthier our kidneys. And of course, we should improve our personal hygiene. We should ensure that we don't patronize drug vendors, medication vendors, both the one that comes in both the one that is packed in form of tablet or the one that comes in liquid form, excessive intake of alcohol. So these are key things we should adhere to if we want to ensure healthy kidneys. Thank you.
Dr. Ayoola Odeyemi, Consultant Physician and Nephrologist with Lagos University Teaching Hospital. Thank you so much for your time and expertise. We really appreciate you.
You're welcome. You're welcome.
It is still Sound Health on Lagos Television. We now bring you trending health report from around the world. Please stay tuned. This is why we say thank you on today's edition of Sound Health. Remember, you need to report medical help or medical condition early enough to the nearest healthcare provider. Protect yourself and your loved ones from COVID-19. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.